Triceps brachii is a three-headed, cap head muscle of the arm. It represents the only constituent of the posterior muscle group of the arm, spanning almost the entire length of the humerus. The triceps brachii muscle consists of a long, medial and lateral head that originate from their respective attachments on the humerus and scapula, and insert via a common tendon on the ulna. The main function of triceps brachii is extension of the forearm at the elbow joint. In addition, its long head contributes to the extension and adduction of the arm at the shoulder joint. Besides movement, the triceps brachii also plays a role in creating anatomical spaces, which are traversed by neurovascular structures. This makes the triceps brachii muscle an important surgical landmark. The triceps brachii muscle has three heads, each of which have their own origin. The long head arises from the infraglenoid tubercle of scapula, which is a rough area at the inferior margin of the glenoid fossa. Its attachment extends slightly above to the adjacent glenoid labrum and blends with the glenohumeral capsule of the shoulder joint, contributing to its stability. The lateral head originates from a narrow, linear ridge on the posterior surface of the humerus, just superior to the radial groove. A portion of the muscle fibers also arise from the lateral intermuscular septum. Its attachment ascends obliquely beginning from the lateral border of the humerus behind the deltoid tubercle. From here, it extends to the surgical neck of humerus, medial to the insertion of teres minor and above the attachment for the medial head of triceps. The medial head is overlapped by the long and lateral head of the triceps. It has a broad origin along the entire posterior surface of the humerus inferior to the radial groove. More specifically, its attachment extends over an elongated triangular area on the humerus. The apex of the triangle is located on the medial border of the humerus above the insertion of teres major, while the base is the line that connects the medial and lateral epicondyles of the humerus. The medial head has an additional attachment to the posterior aspect of the medial and lateral intermuscular septum. All three muscle bellies converge onto a common tendon, which inserts to the posterior aspect of the proximal surface of the olecranon of the ulna. Laterally, a band of fibers continues inferiorly over the anconeus muscle to blend with antebrachial fascia of the forearm.